in the media conference with Lal Goel, which is brought to you by V4 News, Global TV, V4 Stream, मलनाडु टीवी इंडिया, न्यूज गांव से, संवाद सरोकार न्यूज, भारत पोस्ट न्यूज, organ donation India Foundation and Gyan. Our endeavor is to enlighten you with the current topic, and today our topic is role of youth in community health. Young people, when informed and empowered, when they realize that what they do truly makes a difference, can indeed change the world. Community health is a major field of study within the medical and clinical sciences, which focuses on the maintenance, protection, and improvement of the health status of population groups and communities. It is a distinct field of study that may be taught within a separate school of public health or environmental health. The WHO defines community health as environmental, social, and economic resources to sustain emotional and physical well-being among people in ways that advance their aspirations and satisfy their needs in their unique environment. Medical interventions that occur in communities can be classified as three categories: primary care, secondary care, and tertiary care. Each category focuses on a different level and approach towards the community or population group. In the United States, community health is rooted within primary healthcare achievements. Primary healthcare programs aim to reduce risk factors and increase health promotion and prevention. Secondary health care is related to hospital care, where acute care is administered in a hospital department setting. Tertiary health care refers to highly specialized care, usually involving disease or disability management. The success of community health programs relies upon the transfer of information from health professional to the general public using one-to-one or one-to-many communication or mass communication. The latest shift is towards health marketing. The public healthcare system in India evolves due to a number of influences from the past 60 years, including British influence from the colonial period. The need for an efficient and effective public health system in India is large. Public health system across nation is a collection of all organized activities that prevent disease, prolong life, and promote health and efficiency of its people. Indian healthcare system has been historically dominated by provisionizing of medical care and neglected public health. 11.9% of all maternal deaths and 18% of all infant mortality in the world occurs in India, ranking it the highest in the world. 36.6 out of 1,000 children are dead by the time they reach the age of 5. 62% of children are immunized. Communicable disease is the cause of death for 53% of deaths in India. Public health initiatives that affects people in all states, such as the National Health Mission, Ayushman Bharat, National Mental Health Program, are instilled by the Union Ministry of Health and Family Welfare. There are multiple systems set up in rural and urban areas of India, including primary health centers, community health centers, sub-centers, and government hospitals. These programs follow the standards set by Indian Public Health Standards documents that are revised when needed. Public health systems in the colonial period were focused on health care for British citizens who were living in India. The period saw research institutes, public health legislation, and sanitation departments, although only 3% of Indian households had toilet at that time. Annual health reports were released, and the prevention of contagious disease outbreaks was stressed. At the end of colonial period, death rates from infectious disease such as cholera had fallen to a low, although other diseases were still rampant. In modern day India, the spread of communicable diseases is under better control, and now non-communicable diseases, mostly like cardiovascular diseases, are major killers. Healthcare reform was prioritized in the 1946 Bhore Committee report, which suggested the implementation of a healthcare system that was financed at least in part by the Indian government. In 1983, the first National Health Policy, NHP, of India was created with the goals of establishing a system with primary care facilities and a referral system. In 2002, the updated NHP focused on improving the practicality and reach of the system, as well as incorporating private and public clinics into the health sphere. In the context of universal health coverage, the recent policy focus in India, there is an attempt to ensure that every citizen should have adequate access to curative care without any financial hardships. Equally relevant is the acknowledgement of social determinants of health as an important determinant of population health and the need to have a public health cadre within the existing healthcare system. This call for a need to distinguish between public health system and public sector healthcare system, as the latter uses public to indicate the primary role of the government and not necessarily as population as used in public health. Public health funding has been directed to helping the middle and upper classes, as it targets creating more health professional jobs, expanding research institutions, and improving training. This creates unequal access to healthcare for the lower classes who do not receive the benefits of this funding. Today, states pay for about 75% of the public healthcare system, but insufficient state spending neglects the public health system in India. This results in the out-of-pocket health expenditure by households comprising 60.6% of the total health expenditure of India. The Indian government's expenditure on health as a percentage of GDP still hovers around 1.5%, one of the lowest in the world. For around 52% of the households in urban areas and 44% of households in rural areas, the private sector is the main source of healthcare when they are sick, according to government data. It is insufficient to take on a pandemic like COVID-19. Stigma has further aggravated the problem. Misinformation has led many people running away from the quarantine centers, hospitals, and people are not coming forward. The issue of stigmatization stems from fear, prejudice, divisiveness, sometimes from racism and lack of correct information. The preventive measures require frequent washing of hands apart from maintaining physical distance and practicing isolation. Despite tackling the challenge in a mission mode, there remains critical gaps in access of people to potable water and sanitation facilities. The nationwide lockdown has led to loss of livelihoods, education, access to family planning, and sexual and reproductive health services among young couples and young people. There is an increase in reported cases of gendered and domestic violence. Thus, a large number of households are pushed below poverty line every year. Role of youth in community health is very important. We have seen that during COVID pandemic, young people in India are capable to take the country out of the shackles of the ongoing health and humanitarian crisis. In increasing numbers, young people are proactively combating the spread of the virus and working to address the pandemic's impacts. They are at the forefront of the risk communication initiatives. For instance, they can address misinformation, discrimination, and stigma related to the crisis, disseminate information about COVID-19 using various platforms in official and local languages, can promote guidance and guidelines and address the COVID-19 related needs of the most vulnerable in their communities, can provide guidance on through hand washing practices to reduce the spread of the virus, can safely help seniors and other at-risk groups to access supplies such as food and medication, can provide tools for physical activities and sports using social media during the confinement, can find ways to check on and support others' mental health through social media, can also contribute to data collection and monitoring, including in relation to marginalized communities to access the COVID-19 response, as well as in the present scenario to get themselves vaccinated and to motivate others all above 18 years to get vaccination as early as possible to come out from this pandemic. But there is a rider that the youth should not give any misinformation about the prescription, about the diagnosis, because they are not the doctors. They can guide the person that please consult the doctor, and the nearby doctor is so and so. But instead of guiding themselves, you take this medicine, or what is your oxygen level, oh, it is fine, you have no problem, please don't do this. That is my personal appeal to all the youths. Now, to discuss today's very, very important topic, and that is the role of youth in community health, we have 7 youth guests with us, and we have our chief guest. And I would like to invite and introduce my chief guest, and he is Professor Dr. Saurav Kumar. Professor Dr. Saurav Kumar is the professor and head of the Department of Community Medicine at Father Muller Medical College, Mangalore. To seek a challenging career in medical college, public health organization having the environment that encourages continuous learning and provides exposure of new projects, and to achieve professional and personal growth in the field of public health, Dr. Saurav Kumar decided to join medical field. He worked as RNCTP Nodal Officer, Father Muller Medical College, Mangalore, as National Master Trainer on HIV/AIDS counseling issues, GFATM Round 7. He was State Level Master Trainer on RNTCP Technical and Operational Guidelines 2016 and PMDT 2017. He is resource person for RNTCP Supportive Supervision Workshop, jointly developed the supervision checklist with the State Task Force Tuberculosis Karnataka and State TB Office Karnataka. He is member of State Task Force on Tuberculosis Karnataka. He is also member of Indian Association of Preventive and Social Medicine. He is member of Indian Association of Public Health. He is also member of International Epidemiological Association. He is the nodal officer for COVID-19. He published more than 20 research papers in various national and international journals of repute. Welcome, Professor Dr. Saurav Kumar on our show. Professor Dr. Saurav Kumar, being the professor and head of the Department of Community Medicine, you know very well about the community health and the role of youth, because during this pandemic, everyone has become a doctor. And that is the worst part in India. In the first wave, people were understanding what is COVID. So they were not having that much knowledge about the WhatsApp University. But now, in the second wave, everyone is using their own knowledge and try to impart that half-cooked knowledge to others, which is creating lots of problems, especially for the community health. Now, being an expert in this field, we would like to know from you the role of youth in community health. Professor Dr. Saurav Kumar, please.
A very good morning to all of you. Thank you, Lal Goel sir, for giving me this opportunity on talking on the issue of role of youth in community health in the present scenario. In fact, when we talk about the word youth, look at different government policies or the WHO document or UNESCO or United Nations document, there is some sort of differences. Why I'm saying differences? The WHO document says the youth means the age group of 15 to 24 years. Some people use the word youth and young also interchangeably. When we talk about young, it is 10 to 24 years of age. And the National Youth Policy, what we have of Government of India, says the youth is basically age group of 15 to 29 years. Well, first of all, I would like to acknowledge this thing that I'm not a youth anymore now. I may be like youth from the heart, but right now I'm crossing around 39 years of age. So I don't belong in the category of 15 to 29 years though. Okay. So what my point is, like this age group is varying in different guidelines, different organization, and that's the same way like our youth are also. We they will be in a confused state to some extent. As I was rightly pointing out earlier also, that the WhatsApp University, the YouTube University, the Google, like we're looking the messages for that and trying to give the information to the others. Okay, now this thing needs to be avoided, and we expect you to look at the various potential, the tremendous potential what you have got in yourself to basically like contribute to the community health. Now, before we talk about community health in general, I'll just say like why we are focusing on youth. Why probably Lal Goel sir has taken on the youth this issue. Have you ever thought like what percentage of our population is youth? If you look at the document of United Nations, they say like in 1995 we had about 18% of the population contribute in the age group of 15 to 24 years. And in developing countries, almost majority of the population of the world of youth population resides in developing countries. Almost, we can say 80% of the youth population resides in developing countries. And by 2020, 2025, we may be looking at about 89% of the population, youth population residing in developing countries, where you have got a double burden of disease, both communicable as well as non-communicable diseases too. Okay, so it's a challenge in itself, and I think the population, what our country has, 1.23 billion population, if you're looking at, you name a disease, and we will be coming in the top 5 as far as the country is concerned in absolute numbers, not maybe in terms of the percentages though. Okay, now the National Youth Policy document mentioned that as of now, about 28% of our population is the youth. That's you people, 28%. It's a majority, correct? I will say in terms of proportion wise, 28% is a huge number. You're contributing about more than 1/4. Now, to have you actively participate in the community health, first of all, we need to look at key points. We need to develop our youth also. We just simply cannot put you on the razor edge and start doing the activities. Now, in this aspect, if you look at the National Youth Policy also, it says that we want to empower the youth of the country to reach their full potential. And how do we expect you that you people reach the full potential? First and foremost thing, creating a productive workforce. To create a productive workforce, we require importantly 2 aspects. One is the education. Okay. Now, believe me or not, if you look at present scenario, what is the condition of the state-run government schools throughout the country? And would you prefer to put your the future generations as to like your future generations to go to government schools or the private schools? And if there is a drastic difference between the educational standards of the government and private schools, are we not creating a barrier in the beginning itself? Yes, we are creating a barrier. We're making their job tougher and tougher to go for the higher education. Then there'll be more dropouts. More dropouts means, as sir was pointing out earlier, we're looking at more focusing on the non-correct source of information and not be focusing on, you can say, the correct sources of the information of various diseases. Okay, mainly on WhatsApp University. That is one. Then coming your employment part. If you look at majority of the work population in our country is in the unorganized sector. And to make them come in the mainstream and contribute effectively for the country's development, we need to have some sort of promotion of your fundings from the government, which is already being now provided through the small scale industry format. The loans are being given, or the medium scale industry format, like loans are giving to the entrepreneurs. But this is not just sufficient. This is a vicious cycle of a good quality education and then the employment. And then we can look at probably a strong productive workforce. But there's only the one phase of this aspect. Second thing is, we look at healthy generation. A healthy generation, how can we achieve that? So I was specifically focusing on physical, mental, and social well-being also, what we define the health, and not just the absence of disease or infirmity. And physical, the balanced lifestyle, talking about the balanced nutrition, talking maybe like avoiding the junk foods on a daily basis. You look at any of the canteens of the colleges and the schools, I think very few colleges are there which are providing the non-junk food as a routine in their canteens. Now, if you're having the junk food in the routine, we're looking at the burden of non-communicable disease in the future. In fact, for sharing our own examples, if I say, when we see in the field and the primary health centers, almost 30 to 40% of the patients, what we see are of non-communicable disease only. Okay, that is one. If you start suffering from non-communicable disease like hypertension and diabetes at a very young age, what we are seeing right now, just think about the cost incurred. So I was focusing on out-of-pocket expenditure also. It may vary from 1,000 to 4,000 rupees on a monthly basis, the cost of the drugs itself. And then what about the other expenditures, other expenses? So that is for your healthy, you can say the nutrition part. Lifestyle also includes the physical activity. Well, in fact, this COVID has led for the last 1.5 years, we all of us are locked in our respective homes, and the physical activity definitely takes a toll over there. If physical activity is taking a toll, we're not able to go for at least 30 minutes of physical activity, how we are thinking of keeping ourselves physically healthy, which is the backbone of being the mentally healthy also. Then preventing ourselves from getting to the addictions. That's a very challenging thing. Like we keep on reading in the newspaper time and again that the schools and the colleges are becoming the focus of various addictions. It may be addiction starting from the mobiles. It may be addiction to the television. It may be addiction to the games. It may be addiction to substance abuse, like starting with the cigarette or going for the alcohol, and even going for the worst case scenario, the drugs over there. Okay. So we need to like protect our youth. We need to give them the proper education, build their capacity first. Then we're looking at their role in community health. Second, good social values. And that comes first from the family and from our teachers in the school itself. Okay. Then participation in your at all levels of governance. I think when we say the youth 15 to 24 years, at that point of time you will be in the class of 10th to 12th, and you will be having the exposure to various aspects, like it may be a scout and guide, it may be national NCC over there, and you may be a part of the NSS National Services Scheme, and you may be also a part of the various youth clubs or youth organizations. You need to participate in that. Don't be just a bookworm over there in your life, because we want the holistic development in the youth first before we can expect the real role in community health development. Okay. And you cannot just leave your soldiers behind. There may be some people who are who fall into the trap of addiction somehow, who are disadvantages for some of the reasons over there. Okay, you specifically need to keep our friends, our brothers together itself, build their capacity so that we mainstream them. Okay, so this is like the national youth policy, the key objectives we're looking at. So if these things are focused, we are definitely looking at a stronger, healthy generation of youth with a good social values, and then participation in governance at various levels, whether it starts from your school or college or the state level or the national level. Okay, and then obviously like not leaving behind your brothers. That means looking at your own friends who have been into some problems, to build their capacity and to bring them into the mainstream. Now, so was stressing on the role of community health. I'm not sure like many of you are actually aware like what we as community physicians do. So I'll say we have a 5-star approach. We as a community health physician, we are care provider, number one, where we see the patients, but as a primary healthcare physician. Obviously, we cannot expect the non-medical youth in this case to contribute over here. But in the other aspects, like what we have as decision making, where we look at the percentages and proportions of the various diseases in the community, and then make an action plan for the prevention and control. So there, definitely you have a role to play as in a managerial capacity, helping up the health settings community over there in going for the prevention and control aspects as a wonderful communicator in the field. That's one of the, I think, the objectives we're looking at in having the amongst the youth. And then obviously like your community leadership capabilities, whether it's again at the, I said, college level, school level, or the district level. Okay. Now, the potential is immense. Youth, youngful, you keep on yearning for improving your standards every time. If you look in terms of open-mindedness compared to the higher generation, where we find it difficult to change, you people are always open to change. So change is a very difficult process. Think of the newer ideas, think of the newer concepts. You already do it. You have got immense information with you available. Information age, like in which we are living, all the informations are easily available to you, which was not there maybe like if you look at some 15, 20 years back in this much abundance. Outreach services. So I said to youth, young, and like contributing in outreach services. So one example I'll give, I think I have seen one of my mentors taking up this role over there in the beaches in Dakshin Kannada and Udupi region over there. I'm just giving an example. So taking the initiative to at least clean the beaches. I know it's our responsibility to ensure wherever we go, at least we keep the place hygienic. But as I said earlier, it's very difficult to change the people's behavior many a times to keep on throwing the garbage everywhere. But if you take an initiative in your respective areas to clean, but not just clean, we want it to go into continuity. So you need to obviously look at going for advocacy to the media, what we have given a platform to you in this particular session also, and maybe elected representatives, because we need to make it a continuous cycle. Every time it may not be possible for you only to contribute over there going on a daily basis. Fix some time, fix some days. And once you started, it's always the problem of starting trouble. Once you started, believe me, people will start following you. And in fact, my mentor, when she started along with her son and the other youth in that area in Kundapur, it started happening regularly. Almost every Saturday, they do it routinely and ensure that the beach is clean because it's our place. It's our beach, correct? Then you are, if you look in that way, unstoppable, I will say. There's so much of verve and vivacity you have, the enthusiasm you have, and you can also look at unconventional methods. Probably like if you cross this youth age over there, you may be looking at traditional methods of approaching a particular disease, a particular problem over there, but you have a variety of ideas. So what my point is, just don't follow what the others have been doing. You have the nobility in you. You can think of the newer ideas amongst you and try to implement that. For example, as a part of, I'll say, in terms of advocacy aspect, still we are looking at the problem of the dowry in our communities. I'll say like, yes, it is definitely evil or necessary evil you want to say, but as a youth, yes, you have the potential in you to be unstoppable and ensure that be unconventional and stop this, you can say this conventional habit or conventional custom or tradition of the dowry in the community itself, which creates a burden on the female who is going to another house, on their family. Maybe like still we keep on looking at the news, though more in the northern part of the country, the deaths happening because of the dowry itself or the various social stigma associated. This is one example I gave you regarding the dowry. One more example I'll share in this case is regarding the reproductive and sexual health. Okay, now people have their like misconceptions. They don't want to access the health services. And that's where we look at you people looking in unconventional methods through your WhatsApp or maybe the media or the Facebook in this case, and creating awareness. because we want you to be communicator, not just one-to-one. We're looking at the mass communication also, and you have a strong power. You are omnipotent, I will say in this case. Tremendous capacity you have. And if under the guidance of the seniors, you have to always look at the experience of the seniors also, with the people put the trust on you, with the tremendous potential you have, you can definitely look at uh, bringing down the social issues, or like helping or working together in moving towards, you can say, reducing the social problems or reducing the stigma and discrimination regarding the various social issues, whether it may be the reproductive and sexual health issues, it may be STI, it may be reproductive tract infections, it may be HIV/AIDS. Okay, then you have to be a hero. H stands for the hero, correct? And you are the hero for us. You are the heroes for the future, because you can play and you will be playing a role, not just for your own self. You'll be acting as a leader for everybody. Now, where all you can put as a work as a leader? I say there are basically four key areas I feel probably you can work as far as community health is concerned. And one area is first is your peer education. Now, when you look at your own friends, maybe your classmates, your colleagues, going into the habit of addiction or substance abuse, so we need you to like educate them at your own age. If you are giving them the information, the correct information over there, and trying to bring them it's slightly easier compared to a senior giving them instructions, because they will be more comfortable in speaking to you people. And when we say they fall into addiction, it's also because of the peer pressure only. They see their own friends going for the either it's like the cigarette you talk about, alcoholism, and under the peer pressure, they also start doing it. That's what most of the students say. And one of the finding what we got in our research on tobacco use amongst the students of a particular medical college. So, and most of the studies have said like that, on peer pressure is one of the important factors. And I'll take in a opposite way. I'll say like if we have the peer educators, the people who have come out of it or from the same age group, if they take the action, we can definitely look at controlling this problem to some extent. And coming to the role of in youth advisory boards. Well, I know it's difficult. You are studying in the school and the pressure is there that you have to crack the entrance exams, you have to get very high marks, because finally your employment depends upon that. But one of my mentors, in fact, my dean only always says you need to have a fine balance between the things. So what do you mean by fine balance? That you focus on the education, yes, because finally we're looking at a good quality education can give you a good employment. But we also need you to work in the extracurricular activities and the outreach services, which are through your maybe Bharat Scout and Guides, it may be the National Cadet Corps, or it may be the NSS or the local youth clubs. If you're looking at the colleges, the Red Ribbon Clubs. Now, NSS, have you heard of NSS, National Services Scheme, where the students of the college or the schools, the higher institutions, they will be like going for the outreach activities. One simple example as Swachh Bharat Abhiyan only. Okay, going and I think this time if you look in Mangalore city itself, the Ramakrishna Paramhans mission along with the local youth did a wonderful job for weeks together over there, going to each and every area, maybe like cleaning the roads also, creating wonderful pictures on the walls so that people don't make them dirty. And like when they see the good messages coming up, it gives an education to them that please do not spoil these places. But again, this has to be continued, correct? We can't expect Ramakrishna mission to like continue it every year. The youth have to come together. It has just given us the direction and we need to follow that direction. And as a part of these organizations, you have to be a part. Don't think that your studies will be affected. Yes, you have to give some time to this, because if you're not giving the time, this mind is if you're not, you can say, using it during the leisure time, then you're going for the other addictions, which we want you to avoid. The mind has to be occupied. An empty mind is a devil's workshop, we say. Advocacy. and governance. We'll see one by one, like what role they can play in the advocacy part. But and again, regarding the peer education thing, one thing I missed was your reproductive and sexual health problems. Okay. Now, in fact, when I discuss with the medical students also, sometimes they find it difficult to talk about these issues. It's a live telecast, I can see. But again, a lot of hesitation is there when we talk about the family planning issues, when we talk about the prevention of sexually transmitted infections and reproductive tract infections, how it can be protected. And you would have seen these things, how it happens in the supermarkets, general stores also over there. When if you are going to purchase sanitary napkins for the you can say the good reproductive health in the case of the females, most of the times it is packed in some black paper or some brown paper over there and given, because we do not have the acceptance of this reproductive and sexual health. You need to be aware of that. Please go for the correct information on the reproductive and sexual health services which are available in the community, which are available in the health centers. Do not go for the answer.yahoo.com and the Google messages over there, because you will be going into a big trap also. You'll be going to the quacks also. In fact, if you see in the when you're traveling in the train or the buses, at many places they will mention over there that for so and so problems, the Gupta problems or secret problems or sexual problems, please visit so and so particular doctor. But there'll be no mention of degree of the doctor over there, whether it's an Ayurvedic doctor or an MBBS doctor, like that. What my point is, we are looking at creating the role models amongst you who are looking at accessing the health services from the right thing, going to the correct information. And then lifestyle changes, we've already seen how we can go about like having the balanced diet, and obviously the physical activity is a very, very important thing we cannot neglect at all. I've talked to you regarding the role of NSS and all. Now my point comes to advocacy efforts. Just 5 minutes. I'll try to finish off in 5 minutes. Yes, fine.
Try to be brief, because we have to take the accommodate the youth also. You can take, you
Yes, sir.
can say about in the next round if you want, doctor. We will
Just
take it in the
2 minutes.
next.
I'll try to
Okay.
summarize.
Yeah. Okay,
Yeah.
please.
So advocacy efforts. Okay. So whom to advocate? In fact, if you 10 or 15 youths go together to meet an elected representative, it may be an MLA or member of parliament also, there is a big pressure because they know that you are the future leaders. Focus like what problems you are facing in your areas. You need to identify the problems in your areas by yourself through your youth organizations and the clubs. Go to them. Believe me, when you put your views in front of them, they will definitely take some action. Maybe they will definitely assure you with some action over there. Sitting in the room, sitting in the home and thinking that politicians are not doing, the government is not doing, that is not going to work. We have to bring the or you can say problems or the issues and give it to the elected representatives, and also to the media and general public, the important issues which are there. If you're going from the youth organizations and youth clubs, focus on these problems and issues what are common in your areas. Believe me, that's very important. We have to be area specific. And as sir is also the, I think, chairman for organ donation thing, this is also one thing you should look at. Organ donation, probably like your body donation also, if we can commit ourselves at this age itself, it will be a wonderful role model for the future generations too. And governance, your participation in the politics. It's slightly tricky, I'll say. People say like politics may not be good, whatever it is, but we cannot just blame the politicians or blame the leaders over there by sitting from outside. If you want to be, if you want to have the change, you have to be a part of the change. You need to be a leader by yourself. So I'm not saying like put your time, again have to find balance between this. So you join the organization, whether like it's your politics of your university or politics of your college over there, but have an active and healthy politics and work for your community. Okay. I'll just wind up by saying the one saying of Swami Vivekanand, keeping these 4 areas in which you can work for community health. And please arise, awake, and stop not till your goal is reached, till your active participation in the community health happens. So with this, I'll just give a pause so that other speakers can contribute.
Okay, thank you. Thank you very much, Dr. Saurabh Kumar, for giving very, very inspirational and motivational thoughts of you. And I will just highlight one or few points of him. He says, first, you yourself be fit. The youth has to decide if they want to participate in this program or any program, if they want to be a successful person, first they should be fit. If they are fit, then they can keep others fit. And second point which he has raised is the peer mentorship. You have to see to it that your friends and your other those who are of your age or less than your age, you must become the mentor for them so that they will learn good things from you. You can very well guide them for many things. He has also mentioned about the community leadership, that the youth should become a community leader. The community leader means that you should lead others, but it should be in a proper way, not that you are misleading them. He also mentioned that the things in the places where you are staying, you must see the place near to you should be clean and hygiene. And he has given the example of, if I am not mistaken, I know her, Dr. Rashmi Kundapur, correct, doctor, you were mentioning that she has worked herself and with her son, as he has mentioned, alone. She started, and then the people started joining, and I have seen the photographs when so many people have joined her. Now this is called leadership. This is called the how you can be the leader. Right now she is the assistant professor in additional professor, I think, in the All India Institute Medical Sciences, Hyderabad. And dowry, yes, this is a very, very important point here, although it is not connected with this. Only I will say one thing in this: when we are talking of dowry, it all depends on youth. If you say no, your parents cannot force. After all, even if you are a boy, say no, I don't want dowry. If you are going to marry with any girl with a dowry, I'm not going to accept. Now this stand has to be taken. So don't blame the old custom, don't blame the parents, blame yourself if you are accepting the dowry. Then he has mentioned about the mass communicator. You become a mass communicator, but positively. No fake news to be spread. And then hero, you are the hero. If you have to maintain yourself as a hero, not as a zero, then please become a role model for the youth or for the others. Thank you very much, Dr. Saurabh Kumar. Your today's thoughts are, I will say, yes, you are not a politician, but this is leadership quality. This is what we require. Although he's a doctor, but if you also, whichever field you are working, going to be, you should have this type of leadership quality so that you can become a peer mentor. Thank you very much, Dr. Saurabh Kumar. Now I would like to invite my first youth guest, and he is Mr. Aniket Shenoy K. Mr. Aniket Shenoy K, you have heard what our chief guest, Dr. Saurabh Kumar, has spoken. Now we would like to know from you the role of youth in community health. Please.
Good morning, Dr. Kumar and Mr. Goel. First of all, I would like to thank you for providing me this opportunity to put forward my views on the role of youth in community health. So I would like to tell, I would like to proudly tell that organization which you spoke about, it's called Clean Kundapura, if I'm not wrong, Dr. Kumar. It was started by our friends. We started it back in 2012. I'm a part of that thing, and Dr. Rashmi and her son joined us in the later part of the organization. So she's a part of our organization. So we have cleanup drives every Sunday where we go to the beaches in Kundapura. It's Kodi, and we clean the beaches for community, and we educate people regarding the different aspects of cleanliness that needs to be maintained. So coming to me, I'm Aniket. I'm presently a second year bachelor's, pursuing my bachelor's in computer science and engineering at Sri Madhavadi Raja Institute of Technology and Management, Pantakal. So more about me, I'm a Young Scientist Awardee by Government of India and by Government of Karnataka. I'm a gold medal winner in a national level science model competition organized by DST and Indian Institute of Technology, New Delhi. I'm also selected as an Indian ambassador to Japan-India Youth Exchange Program in Science, organized and sponsored by JST, Japan Science and Technology. I'm also nominated as an honorary member of Sakura Science Club. And I've been in interaction and experimental sessions with different Nobel laureates and scientists. I've also been a resource person for Japan-India strategic relation in science and technology at Embassy of Japan, New Delhi. So now coming to today's topic, I would like to start with a quote. Uh, Act on the educated young men, bring them together and organize them. Great things can be done by great sacrifices only. No selfishness, no name, no fame, yours or mine, nor my master's even. Work, work the idea, the plans, my boys, my brave, noble, good souls. To the wheel, put your shoulders. Stop not to look back for name or fame or any such nonsense. Throw yourself overboard and work. So this was said by Swami Vivekananda to the youth. So working on that, coming to today's topic, that is the role of youth in community health. I would like to speak about the youth in the present context of community health. So it is in the present context, I mean, is the pandemic situation. So in this scenario, I would like to reiterate certain points by Mr. Goel. So young people in India are capable to take the country out of the shackles of the ongoing health and humanitarian crisis. So how is that? As the daily report suggests, the poorest and the most marginalized daily wages, migrant workers, hawkers, contractual workers, and informal workers are disproportionately impacted since their livelihood is lost. It is exactly said, rightly said by Mr. Goel. So, among the most impacted are the helpless youth. So, 1/4 of India's population is the youth, as rightly said by Dr. Kumar. So, what are the challenges that we face? I would again like to reiterate the same challenges because those are the, giving a brief outline of the challenges faced by, a community as India as a whole. State of public health care in India. India's government expenditure on health is as a percentage of GDP is around 1.5%. Like rightly pointed by Mr. Goel, it is the lowest in the world. US has the highest with 22%. So that is the amount of GDP that's going into health sector. So now when we are in the pandemic situation, we as a community are facing or understanding the true value of health sector. We are understanding what is the need for health. When we did not, if we would have had an improved health sector, we would have managed this crisis in a better way, I suppose. So then about misinformation and stigma. So yes, I would like to point this out to the youth are mostly concentrated on what you term as WhatsApp university or Facebook university. So that's the place where we get more information on. So when we get information there, we don't cross check the information. We just believe what is there is true, which is not right. So this is a main focus of community medicine, if I'm not wrong, Dr. Kumar. So this misinformation should be addressed, and the proper information regarding the healthcare should be provided more than to the people who are old. It should be provided to the young. Why should it be provided to the young? Because younger generation are open to the society, so they get interactions with the people in the society. So what advantages does the youth have over the older generation? The youth have good communication skills because the present youth can speak well to the people, because you have such a holistic development that is happening to the youth at colleges. So you have different platforms, as told by Dr. Kumar regarding NSS, NCC. Why not start an NGO? Actually, our friends, I am a part of an NGO. I am a part of multiple NGOs. So we work on educating people regarding what we can do as youth, how we can educate people. Coming to water and sanitation. So this is a very important topic when it comes to community health. The preventive measures require frequent washing of hands, as we all know. And then there is, maintaining physical distance and practicing social isolation. Tackling this challenge in mission mode, this still remains a critical gap in access for people. Impact of lockdown, if I have to tell, the nationwide lockdown has
Please be brief.
has led to loss of livelihood. So, if I would like to conclude this, what we have to do as youth is to educate people, and remove the misinformation that they have. With this, I would like to briefly end my talk. Thank you.
Thank you very much,
Thank you for
Mr. Thank you very much, Mr. Aniket Shenoy, for giving your views. First of all, we would like to congratulate you for the achievements which you have achieved in such a short time of your age, youth, prime youth. And what you said, yes, right. One must verify the information, and not only verify. If you find that that is a news, a fake news, I always say send back along with that fact check to the person who has forwarded that news to you, and say that is a fake news, and request him to send back to the person who has sent to him. So break the chain like this. So any fake news which you are coming through, see to it that it should go back and it should reach to the person who has originated the fake news. Then he will not dare to start the fake news in our country. Thank you very much, Mr. Aniket. Now I would like to invite my next guest, and he is Mr. Arul Shankar N. Mr. Arul Shankar N, you have heard our chief guest, Dr. Saurav Kumar, as well as earlier youth guest. Now we would like to know from you the role of youth in community health. Mr. Arul Shankar, please.
Yes, sir. Can you hear me?
Yes, please. Go ahead.
Oh, thank you so much for this thing, sir. And I would like to thank my teachers for giving me this opportunity. And Mr. Dr. Saurav Kumar, your speech was really inspiring and motivating. My name is Arul Shankar N, and I am a plus two student of Kulapati Munshi Bhavan's Vidya Mandir Kotor, Thrissur and Kerala. Um, so, what is youth? Youth can be best defined as the transition from the dependence of childhood to the independence of adulthood. We term like those persons from the age 14 to 25, as told by Saurav Kumar, they are termed as youngsters. So, what is community health? Health is that medical specialty that focuses on the physical and mental well-being of the people in the society. So, what is that power of youth in enhancing the community health system? I would like to express my views in 3 points. The first point: youth, they have that unique potential, that optimism, that enthusiasm, that energy, and that creativity, which with which they can collaboratively seek solutions to those complex and costly challenges. We know that health simply does not happen in hospitals and doctors' offices. It also happens in the place where we live, the place where we talk, eat, and play and learn. And to maintain good health in such non-medical conditions, the contributions and participations of the people, especially youngsters like me, is really very important. We have seen that many organizations and projects that work for the betterment of our community health often engaging youngsters to enhance their projects and policies. So why are youngsters called for that? Youngsters are called for that because youngsters, they can understand what's happening around them. They're aware of what the community is. They're aware of the vulnerabilities and strengths of a community. They can better understand situations and work accordingly. And coming to my second point, it's social media and crisis. At this time, we are passing through a tough time of life. The COVID-19 pandemic, it has created dramatic loss all over the world, killing millions of people. And in such a drastic situation, the contributions of our youngsters, especially in India, is remarkable. We make use of social media sites like Instagram, Facebook, WhatsApp, Twitter to create awareness among people. For example, recently we had that oxygen crisis in most parts of North India. And it was these youngsters who spent most of their time on Facebook, WhatsApp, and other social media that created such a great awareness so that the authorities turned their head towards this problem and solved it effectively. So, coming to my third and last point, it's awareness and mental health. In my house, as a young member of my family, it's me who address the issues what are happening around in the world to my parents, especially my grandparents. And likewise, in every family, it's the young members who report the guidelines and guidances and precautions we have to take to combat this disease. And most of us nowadays, we do not go out of our houses, and our life is confined to the four walls of a room. And such a condition where we miss the enjoyment of social life, often lead people to mental depression. And this mental depression can be so drastic that it can even lead to suicidal attempts. So, by addressing these facts, the youth, they can contribute towards the tangible solutions which can make these mentally depressed people happy and keep them rejuvenated. As Mr. Saurabh Kumar said that India is the second most populated country in the world. And recent studies have shown that India at present have the greatest youth and adolescent population than before. And this condition will continue for the next 10 years. Of course, overpopulation, it's creating an ill impact on our economy and growth. But when we look from the other side of this fact, it means that India has got a good lot of energetic and enthusiastic youngsters. And if these youngsters are well trained, if they are properly given the guidance, of course, this burden can be made into a blessing. And if each and every one of our youngsters come forward and do his and her own contributions through India, I'm sure that India will be one of the most developed countries in the world soon. History, it has been always developed by the youth, and it will continue to be so. That's all from my side. Thanks so much.
Thank you very much, Mr. Arul Shankar, for giving your views. And yes, you rightly said about the oxygen crisis. Youth played a very, very important role. And not only oxygen crisis, even in the Kerala, when the floods were there, the youth played the very important and very responsible role. And that's why how the government could overcome the crisis so soon. Thank you very much, Mr. Arul Shankar. I'm sure the youth, if you have such type of energies among you, the future of the country is very safe. Now, I would like to go to my next guest, and she is Miss Ferlin Martin. Miss Ferlin Martin, you have heard our chief guest, Dr. Saurabh Kumar, as well as earlier youth guest. Now, we would like to know from you the role of youth in community health. Miss Ferlin Martin, please.
Yes, history has always been made by powerful youth. Youth has a great play in the health community. In building the community, youth plays an incredible and prominent role. As Sir Goel said, in the youth of Kerala has been really helpful through all the crisis time. And I'm proud to say that the youth of Kerala was celebrated as a model for all the world's, all the countries across the world to face this unprecedented pandemic. The youth came together in 2018 Kerala flood, and now they are back to battle to the COVID-19 crisis. Around 2.36 lakh volunteers from across the state have enrolled in this youth task force. I would appreciate the state government of Kerala for arranging such a task force, especially for youth. And I guess that would be a inspiration for all the countries and all the other across the world to give a place to youth. Let them do their parts or let them do what they want to do. I would also like to say what the doctor said about the conventional ideas, the stereotypes. Youth have no barriers. Youth have no caste. Youth have no racism. For them, everything is just humanity. And I'm sure youth have been really helpful to cope up and in breaking with the stereotypes India has been coming throughout the traditions. And one more point I would like to add is health is not just about physical fitness. It's also about mental health. We all said that India is the most most populated when it comes to youth, but it's also in the #1 list of depressing people. It is a really sad news to hear. Even the youth, around 38 to 40% of the youth are going through like depression, anxiety disorders. But our Indians have a myth that all this is a lunatic or abnormality. We should break that stereotype. If being depressed or having a mental breakdown is not a part of being lunatic or abnormal, we need to have a safe and open space where we can talk about it, where the youths are given a chance to talk about what they want to. We need to educate and empower the youth. Not only the youth is having such problems, we see so many with the lockdown and the COVID crisis, we see so many actors and so many other people who is committing suicides just because of this mental depression and mental disorder. I request all the higher authorities, even for ourselves. In our college, we have this group where we can just come and talk about any problems we want. And I think that is a really good idea to initiate in all the other colleges and all the other possible places. And being NSS volunteer, I have been there for the COVID-19 volunteer service, and even for the Kerala flood, I was being a great part, and it makes me so honored to be a part of the youth of India. And I am sure, I guarantee you, from all on behalf of all the youths of India, that the future of India are in safe hands. Thank you.
Thank you very much, Ms. Ferlin. Yes, your guarantee, we accept the guarantee because we have seen how youths are speaking. One point which you have made, very important point about the task force. Our chief guest, Dr. Saurav Kumar, also mentioned the same thing. And if it is what done in Kerala, why not in other states? If we will have such type of youth task force, even if the government is not doing, even if all the youths will decide to create such type of task force in even in their own community, in their own areas, it will be very, very beneficial. Thank you very much, Ms. Ferlin, for giving your views. Now, I would like to move to my next guest, youth guest, and he is Mr. Karthik Bhalla. Mr. Karthik Bhalla, you have heard our chief guest, Dr. Saurav Kumar, as well as the earlier youth guest. We would like to know from you the role of youth in community health. Mr. Karthik Bhalla, please.
Thank you so much, sir. A very good morning to all of you present here for this conference. Hope you all are safe and healthy at your homes. I would like to tell you about myself. I am Karthik Bhalla, an author, digital practitioner, and a beginner entrepreneur. I provide digital services and training to our clients online across India and global. So before coming to our today's topic,
Which city you are based?
sir, I am from Mohali, Punjab. Mohali,
Mohali,
Punjab.
Punjab. Okay,
Yes.
please go ahead.
So before coming to today's topic, I would like to thank Mr. Lal Goel sir and Paul sir for inviting me here for this media conference. Also, I would like to thank Professor Saurabh Kumar for giving their valuable views on today's topic. So let me share my views on today's topic. As a youth, a regular get in touch with youth of my generation, like my colleagues, employees, friends, students, and my siblings via technology and physical gatherings. So I observe that we have a very good healthcare delivery system in India. So if we talk about community health, so it is a major field of study within the medical and clinical sciences, which focuses on the maintenance, protection, and improvement of the health status of population. So if we're talking about healthcare delivery system in India, we have a public sectors also in which we have sub centers, PHC, CHC, district hospital, and medical colleagues. Also, we have a private sector in which we have a private hospitals, clinics, and general practitioners. Also, we have a voluntary health agencies and national health programs are running to help people in every situation. But again, we are lacking to build better healthcare. Why? I believe the major problem in our system, we are trained by unaware, unprofessional, and irresponsible senior level community and society. For example, parents always seek for advice from our neighborhood Sharmaji for our child career to make his child dentist or neurologist, right? And in colleges, our teachers are more focuses on theoretical part, not on a practical part. That's why students face major problems in their career levels, and they do a private clinical jobs in a private clinics. Also a major part third is the life when we start our job. So where we start our practical life, from there we are start learning the corruption and public dealings in hospital and clinic scenarios will be same. Our senior teacher teach us to do corruption like major and make big bills and do bigger prescription to a patient if you want to survive for their job. So youth learn and apply the same thing in our conditions. So what we can do, so along with that, to balance this, we have a very good things also. In a lockdown period of COVID-19, you have seen that youth at home saw and learn everything at home via digital mediums like websites, social media apps, and digital medical devices. Like we can check our oxygen from at home. They get to know about conditions of healthcare. I saw youth is playing their role. They're taking charge of their responsibility. They create small communities of people physically who help people, like Robin Hood Academy is doing very good in our nearby Ambala. Also youth help people by creating awareness videos of personal care, diets, nutrition, yoga, and family care at home. Youth build their own public platforms like website, apps, and social groups to connect people from all the regions through the help of technology to help community in terms of medicine, doctor, food, and essentials. So, in the end note, I would like to say that youth have very unique potential as well as the energy, enthusiasm, and creativity to collaboratively seek solutions to complex and costly challenges. Being involved for youth of youth provides an important important sense of validation and empowerment regarding their own lives and their community surrounding. So as a youth, I will try to be more passionate, aware, and responsible to continue the new era of skill development and give back to the society for the betterment. Thank you so much, sir.
Thank you very much, Mr. Karthik Balla. You have made a very important point, and you said that what the youth can do because the bad habits have been passed to him from the elders.
Elders.
Yes, elders can pass. Their intentions are good. They are not. What they think that they are passing you good values might be not. You are not liking it. Why not youth? As a youth, because you are more technological advanced in comparison to the us or the other next generation of me. But if you can teach them, if you convince them that this is right, this is wrong, I'm sure you can be the hero, as our chief guest has mentioned, Dr. Saurav Kumar. If you want to be a hero, you can teach even irrespective of the age. Thank you very much, Mr. Karthik Balla. I will also remember your point. This point is very important, that I should not pass anything to my juniors or to my children. Now I would like to go for my next youth guest, and she is Miss Manisha Gujjar. Miss Manisha Gujjar, you have heard our chief guest, Dr. Saurav Kumar, as well as earlier youth guest. Now we would like to know from you the role of youth in community health. Miss Manisha Gujjar, please.
Manisha Guzar, and I am from Yeshwantrao Chavan School of Social Work, Satara, Maharashtra, and I am pursuing my Master of Social Work in this college. Today, I am very much honored to share my views on this topic, role of youth in community health. As I am a student of medical and psychiatric social work, I know that whatever you are studying, Mr. Goel has selecting in the start, there are three healthcare levels in our India. That is primary healthcare, secondary healthcare, and tertiary. So, as a youth, we can participate in our contribution in primary healthcare, that is prevention and promotion of a health. So, what can we do as a prevention? I would like to share. Instead of sharing views of community health, I would like to share my experience in this pandemic, which we have done. In last year, we have seen that there are so many lack of beds in hospital for COVID patients. So that time our college has tie up with JDP in Jilla Parishad, and we have done a counseling with COVID patients. So that was very good experience, because the patient who are sitting at home and worried about what we have to do for ourselves. So we are counseling them for their good health, like protein diets, measuring their oxygen level, taking walking tests. So it is very better experience, and also it will help them. It has helped them to become good, become the good health. And another experience is, once I have posted my yoga photos on my WhatsApp this activity, and then I have told them that ask them about why they don't join me. So in starting, we have joined with Zoom meeting and start our yoga session. So these little steps are making a huge change in youth. So nowadays what we do all yoga and morning walks and all this activity in our family members, and also we are including our neighbors too. During this, we also done one thing every Sunday, or once or twice Sunday in a month. We are planting a tree, because environment is a very crucial part of our health determinant. So we have to maintain our environment. It is our heritage, and we have to take care of our environment, also drinking water. As we know, there are so many diseases are becomes because of there is no safe drinking water available in India. That's why we have to save our drinking water. I am also agree with our chief guest, Dr. Saurabh said that NSS participation and NCC participation for youth is very important, because in that type of campaign, we have to learn how to cope up with community, how to work with community, how to work with betterment in community. So I totally agree with that. And actually, the actions are speak more louder than words. So this type of small activities also very much doing very much impact on our society. So as a youth, as an individual, we have to start from ourselves. As I started, so a little step ahead towards our goal or towards our community health, it will be affecting on our totally community. So it is very important to participate and then talk. So instead only sharing the views, I would like to that share all these parts. And also I'm happy to sharing my views on this topic. Thank you so much.
Thank you very much, Ms. Monisha Gujjar, although your net was weak. But anyway, you have spoken nicely, and you have mentioned about how you have taken care during this pandemic. It's very nice to hear all your views. Thank you very much. Now, I would like to go for the next my panel youth guest, and she is Miss Shanti M. Machado. Miss Shanti, you have heard our chief guest, Dr. Saurav Kumar, as well as the earlier youth guest. Now, we would like to know from you the role of youth in community health. Miss Shanti M. Machado, please.
Good morning to all. I am Shanti. At present, I am teaching for primary at JMS School at Kalsa. It's my pleasure to be the part of this conference. What is community health? According to WHO, community health is environmental, social, and economic resources to sustain emotional and physical well-being among people in ways that advance their aspirations and satisfy their needs in their unique environment. In order to support this community health, we the youth play a vital role in the society. I would say, in the words of James, youth is the joy, the little bird that has broken out of the eggs and is eagerly waiting to spread out its wings in the open sky of freedom and hope. The role of the youth in collaboration of community health in society is very important. They are the pillar of our community. Where there are young people, there is life, freshness, vigor, spirit, so on. We, the youth, have the unique potential as well as the energy, enthusiasm, optimism, and creativity to the challenges of our society. Today, as we are here to speak on the role of youth in the community health, as a youth, how can we contribute to the community health is a question. We have the example of Swedish environmental activist called Greta Thunberg, who has become a global leader for the environmental issues and leading protests against global warming. She has become a global ambassador for the environmental movement. How do we as youth can get involved? We the youth have the immense power within us. Youth need to educate themselves. They need training, support, and encouragement. As youth, we can join NCC, NSS, and many other environmental groups and health organizations. At times in villages, the poor and the uneducated people doesn't know the various facilities that are available from the government. All of us should look at what we can do depending on the environment. Through house visit, exhibiting posters in prominent places, after obtaining government permission, through road shows, through social media, we can create awareness on health and hygiene aspects. Today, we also find religion intolerance. We should respect other religion and speak good about each other. This will bring peace and harmony in our society and community. There is also gender protection. We have to educate the boys to respect the girls. It's very sad to know that, as already Dr. Kumar told, there are many young people who are addicted for bad habits like drugs, alcohol, and social media, which is causing unhappiness and also increases mental and physical ill health and issues such as anxiety and depression. As youth, we should not indulge, and we also should give awareness to others not to get into it. At this moment, we are suffering with pandemic and living in fear and worries. There are so many corona warriors, social activists, doctors, nurses, and who are sacrificing their own life and are dedicated and committed for the service of humanity. As I was talking to one of the youth who is in a village, he told me that along with other youth, he joined together and he went around the villages with thermometer and oximeter and checked the temperature and oxygen level of the people, and also distributed masks and gave them the awareness. So through our small kinds of gestures, we can promote the health condition to everyone. My dear friends, if we want a better place to live in, we should also strive to make it better. As I end my views on the role of youth in community health, I would like to invite each one of you to join hands together, because when we dream alone, it remains just as a dream. But when we dream together, it becomes a reality. Thank you.
Thank you very much, Ms. Shanti, for giving your views. You have mentioned about the Swedish environmentalist. I would like to inform you the youngest environmentalist in the world is from India. She is Lisi Priya, and she has started her movement when she was only 8 years old, and she is right now only 10 years old. So youth in India, we have lots of potential to show to the world. Thank you very much. Now I would like to invite my next youth guest, and he is Mr. Tejas US. Are you there, Mr. Tejas? We can't see you.
Yes, sir, I'm there.
No, you are not
Am
there.
I visible?
No, you are not visible. You are right now, Mr. India. Where are you? Mr. Tejas, your video is not on. No, I think, okay, Mr. Tejas, then what we will do, we will take you in the next media conference. I would like now to go to our chief guest, Professor Dr. Saurav Kumar. Professor Dr. Saurav Kumar, you have heard all the youth. They have given their views. All have given very, very positive views. Now we would like to know from you about this today's media conference, your concluding remarks. Professor Dr. Saurav Kumar, please.
Very good morning again to all of you. It was nice to hear like that our youth, you all people are working so actively in your own positions, in your own environment, like, and how you're contributing for the community health. Okay, whether it's like, as somebody quoted, like the brave noble souls, you are correct. And you know how to be unconventional. That's what the real thing is. And I think even Lal Goel also was pointing, sometimes as parents, as elders, we try to like force upon or maybe like put our views to you because we think that the children or the adolescent or the youth, they may not have the complete abstract thinking. So it takes time. If you look in the physiological phenomenon also, we say like at the age of 12 to 13, once we are going into adolescence, like in the earlier half, we more have concrete thinking. It's yes or no, and looking at more of the peers only. But gradually, like by the end of 18, 19, maybe like sometimes it may be delayed in some people, you're having the abstract thinking and you can take a decision by yourself. It takes time. So you have the unconventional thing, you know, like once you have the abstract thinking what is right and wrong, you have to put your views in front. Okay, then it was nice to see that people have gone for making small videos as a group, and one of you also mentioned that you have a part of the state task force. So and some people are working without the task force mechanism also, they're having their own groups. But as I said earlier, and Lal sir also was pointing out, if you do not have support from your elected representatives, that's what we want you to build upon. You have taken a small initiative, maybe going in your areas over there, it becomes a role model for the other people. So go to the elected representatives and ensure that it is done in a holistic way throughout the district, throughout the state. And that's where we want you to be the leaders. You have the brave, noble souls, unconventional method, but we need to like take the leadership to another level over there. One nice point, I think probably I didn't mention much in my discussion earlier, mental health aspect. Well, when it comes to mental health aspect, first thing is obviously that physically you need to be healthy to have a good mental health, correct? And I said like you have to focus on physical health. You need to focus on these extracurricular activities because then your mind is occupied in these things. Otherwise, you are going to have an empty mind as a devil's workshop and going into these various addictions. And importantly, what we expect from this youth or youth task forces and all, that in your local communities, have the group. You will know like what are the danger signals of poor mental health. You're not doctors and we don't expect to diagnose a disease over there. But we all know what can be the danger signs and signals of a poor mental health, not sleeping properly, being irritable, like being fighting every time over there. If you identify such things, please bring them to the nearest possible health services because you need to communicate to them and need to direct them to the right place where they should be going and not neglecting their own health. Role of social media, yes, that's like you people are the best in that case, how you fast you can communicate. And I think one of you pointed out regarding the oxygen crisis, the way you have put up, that's where I said like advocacy. We expect you to actively participate in advocacy and you have done a wonderful job in that case, advocacy to the media. And the media obviously will be taken up a very positive way to like highlight the problems what we are having in the community. So you have an active media, you have an active social media, and we have an active youth, correct? And if we have these so many actives together over there, I definitely feel like what one of you was mentioning over there, like we can obviously team together to make it a wonderful reality. So that's all I have to say.
Okay, thank you very much, Dr. Saurav Kumar. Again, you have motivated the youth today, and what you have said is really very, very inspiring for the youth. Mr. Tejas, I can see you. Are you there? You have now only 2 minutes. I can give you only 2 minutes, so you can finish in 2 minutes. Yes, please go ahead.
Yes, hello, very good morning, everybody. I'm Tejas here. First of all, I would like to thank the entire Global TV team and all the panelists for providing me this opportunity. My network was working properly,
Please introduce yourself.
Yes, sir, sure. I'm Tejas CS, currently pursuing my master's degree in business administration, specializing in finance from Justice Case Secretary Institute of Management, NMIMIT NITE. I'm not professionally qualified enough to talk about the technical aspects of physical and mental health, but I believe that I'm noble enough to share my personal experience. So this happened to me 3 years back. I was very passionate about badminton. So to give our best in the badminton court, we have to invest certain time on the field as well. So but that means working out properly and putting ourselves into endurance and agility based exercises. So we were quite irregular at it, which means we used to practice for a while and later take a break again. Okay, practice for a week and then again take a break. So our physical education director noticed this. So one early morning, again we went to the field and he was there jogging. So he came to us. We just started with a small talk, and he just put his hands across our shoulder, and he asked us, what you can see on the field. I was so stupid at that point of time. I said, I can see people, because there were people who were just jogging and doing workouts. And he asked, what is the trait that you can see in them? I told they're all age-old people, I said. And he said, what I can see in them is that they're all working out with regrets. All right, they have reached their peak and now they are affected with sugar, BP, cholesterol, and whatnot. And now they have realized the importance of physical health. I mean, now they have realized the importance of doing exercises. So he reiterated that no matter where you are, no matter what you are doing, you don't belong to that category. All right, no matter what you are doing, you may earn millions and billions together. So what if you can't able to eat the food that you like? What if you can't able to play the sport that you like? It's not a fortune, it's a disaster, I say. He said. Then my takeaway was that no matter where you are, focus on your personal well-being. That refers to both physical and mental well-being. However, I had few more lines to add, but since my time is over, so time management is the essential skills what we have learned in our B school as well. So and I can't just close my speech without admitting the fact that Sir Dr. Saurav Kumar sir, your thoughts and wisdom was just thought-provoking. So thank you so much, everyone. It's my privilege to be here. Thank you.
Thank you very much, Mr. Tejas, and definitely we will take you in the other conference. Surely at that time your net will be working properly. So today, viewers, you have seen how the youth are playing a very, very important role in the community health in their own ways, as our chief guest, Professor Dr. Saurav Kumar, has also expressed his pleasure that how the youth are actively involved. And if you all who are viewing this show, if you are also involved and taking the advantage of the today's program, or even from other youth, if you do something, it will be not only beneficial for the others, but it will be very, very much beneficial for you and for your family, because the community health is not for everyone. It's for everyone. It's not for one person or two person. It is for everyone, including you. Thank you very much, all the youth guests, as well as our chief guest, Professor Dr. Saurav Kumar. And today's program has been live telecasted by V4 News, Global TV, V4 Stream, न्यूज गांव से, संवाद सरोकार न्यूज, मलनाडु टीवी इंडिया, भारत पोस्ट इंडिया, as well as was shown live on Facebook and YouTube. And our endeavor is to bring to you everyday new topic. But for last 4 weeks, we have started a new program in the Hindi in the evening, that is from 4:30 to 5, where we are calling one achiever who has achieved in his or her life. And today, the name of the program is Kal Aaj Aur Kal Lal Goel Ke Sang. It starts at from 4:30 to 5, the program timing. And today our chief guest is Professor Dr. M. Abdul Salam. He is the former Vice Chancellor, University of Calicut. He will be giving his own life, his biography about his childhood and how he has become on the such post he has reached, and what is his message to the youth. So please tune in today at 4:30 p.m. to watch the show Kal Aaj Aur Kal Lal Goel Ke Sang. Thank you very much, all the youth guests, and special thanks to Professor Dr. Saurav Kumar for enlightening us with the community health, and all the viewers who have viewed today's program. Thank you very much.